you have any advice for survivors or families or healthcare providers about approaching TBI?
Sure. Well, this kind of harkens back to your question on the timing of testing. And I think that giving a person the neuropsychological evaluation at various stages gives you a sense of where they're at then. And this is information that can be fed back directly to caretakers. So they know what's going on, what to expect, not to exceed demand. One of the unfortunate things that happens with traumatic brain injury is something that is oftentimes referred to by the moniker of the silent epidemic, which basically means if you break your arm, people can see that. They will react to you appropriately, okay? But if you damage your brain, and particularly if you have a concussion that in daily life, a lot of people can't even tell there's anything wrong with you, but then all of a sudden you're losing your train of thought, or you're forgetful. Oh, you never listen to what I say, when in fact your mind may have wandered. Or, you're being lazy. People tend to be misevaluated by others. Oftentimes they get into situations that the demands exceed their capabilities. So they may go back to work too soon. They may go back to school too soon, and they're failing. And as a result, over time, the demands are exceeding their capabilities. They start getting progressively depressed, anxious, and distressed. And so at the end of the day, even though the brain is functioning better, they're more disabled. And so the neuropsychological evaluation can help you sort out the factors, whether it's the brain, whether it's some other factor, whether it's emotional type of thing, and essentially help the person and the caretakers design the environment that's appropriate to where the person's at.
Is there anything else you want to add?
It's a very gratifying field. It's great to see people with traumatic brain injuries getting better. It's very, very satisfying that you can give these people feedback they understand. Being a neuropsychologist is different than a neurologist, because the neurologist is showing people pictures of the brain and they're explaining these sorts of things that are very critical and important for them to know. But as a neuropsychologist, you're kind of hitting them where they're at, who they are. Like I said, I do a lot of medical legal work, and I always tell the people who come and I evaluate, I said, of course you need to show the MRIs, you need to see the neurologist, and the jury has to understand how your brain has been injured. But ultimately, at the end of the day, they're going to want to know, so what? What does this mean? How does this injury affect you? And as a neuropsychologist, and of course you as a neuropsychiatrist can appreciate, we deal with daily functioning. We're talking their language. We're saying what they can and can't do. They could relate to that. It's very gratifying to be on a person's level and give them information that they can readily identify with and hopefully utilize.